Good afternoon, members of the media present here at the Diplomatic Center, members of the national community at home and abroad on the various platforms. Welcome to our regular meeting reporting on our progress in our response to the COVID-19 virus. Today we'll follow the same format we normally follow, and we have with us our health team and the Minister of Health, and I would like to ask at this stage, Dr. Paraswam, CMO, to come and take us through our normal routine.
Good afternoon, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. So reporting as of the 18th of June 2021, total tests done at the public and private facilities now stand at 215,999. Over the last 24 hours, we would have reported 227 new positive cases, taking our total since March 12, 2020 to 30,183. Total recovered patients thus far, 20,892. Total active cases have gone down to 8,578. Whole persons in home isolation as a proportion, 7,758. Those in hospital remain around 450 for quite a while, now at 452. Deaths are now at 713. Those in step down are at 141, state quarantine 211. And total persons vaccinated with your first dose of both either Sinopharm or AstraZeneca, 173,878. Those fully vaccinated, 36,620. We'll have Dr. Hines take us through the EPI update, followed by Dr. Richards today. So, Dr. Hines.
Thank you, CMO, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. The EPI update for the data as of June 18th is as follows. We see here the epidemic curve, which has tracked from about late July 2020 all the way through to the current date, daily cases as a date of swab. We see in this graph that over to the right-hand side where we see the colorful bars, the tallest ones of those are the ones that we see around that middle of May, that second to third week of May, and we've seen progressively shorter bars as we move towards the right into that blue section, which represents the cases swabbed in the month of June. So we are looking at what seems to be something of a downward trend in the month of June with respect to the number of cases that have been swabbed and have turned up positive. When we aggregate or pull those swabs together by week, what we call epidemiologic week or epi week for short, we see same distribution of colors representing the same time periods. And those gold bars for May being the tallest, we saw that we moved progressively upwards in increasing percentages for some time until we got to week 21. And then from week 21, come forward for the last 3 weeks, we've seen a decrease. Small decreases at first, and hopefully decreases that will continue to increase in size. So right now, we're looking at week 24, which isn't yet complete, but preliminary data would put our decrease between week 23 and week 24 around 7%, or 6-point-something%. And that downward trend, that continued downward trend over the last 3 weeks or so is an indication that we are seeing some slowing in the number of new cases being diagnosed, and that the measures that we've been implementing and adhering to are having some effect. Looking at the data gathered on a monthly basis, we see basically the same pattern, highlighting again beyond the heights of the bars that that background or salmon-colored area represents the percentage positivity, meaning the number of positive COVID samples out of every 100 tests that we do. And that is coming down somewhat, so I'm actually going to go backwards. Just to look at the week 23 and 24, we're seeing that we're down in those weeks to 32 to 30% just about positivity. And overall, for the entire period of June so far, that overall positivity has been about 35%, coming down from nearly 43% in the month of May. So again, that's an indication of some decrease in viral circulation. Looking at the demographics, the demographic data basically remains as it has, with the majority of the cases being in that 25 to 49-year-old age group and the 50-50 division of male and female positives. We are seeing that slight swing, so to speak, of males being less than 75% now of the total number of deaths. They're now around 60%, and the females have taken up that other 40%. And the deaths in the over 60 age group remain the vast majority. But we do note two things. Number one, deaths have occurred in the under 60 age group. And number two, while people who have passed on have, in the majority, more than 75% of those people who passed on had comorbidities, there were some that did not. So that's a cause for everybody to be cautious. Once you become infected, you need to monitor yourself very carefully. Looking at those projections that we'd been making, looking at the speed of increase that we were seeing at the end of April, that green line that goes upwards, it was that sort of trajectory that we were on at the end of April prior to the implementation of a lot of the more stringent measures. Those measures were implemented. We saw that there was a decrease in the number of cases or the rate of accumulation. We looked again at a projection around the middle of May prior to the SOE itself, but the other big restrictions being in place. That's the orange line that we see, and that's the trajectory we would have been on. Again, we've deviated from that and decreased. The current gray extension that we're seeing beyond the bars is sort of the projected level or direction that we're going in with the decreasing daily numbers of cases. And we're hoping that we maintain that downward curve now, as that would indicate that we have a continuation of the decrease in daily positives. And that brings me to the end of the EPI update. I'm going to turn you over to Dr. Richards for the clinical hospital update.
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, Energy and the Office of the Prime Minister. This afternoon, good afternoon again to the members of the media, ladies and gentlemen, members of our listening and viewing population. This afternoon, I would like to present a status update on the hospitals in the parallel healthcare system. And of course, at now, there are 16 institutions under the parallel healthcare system to care for persons who are ill with COVID-19. There are 19 centers in Trinidad and out of these 16, there are 14 centers in Trinidad and 2 in Tobago, and there are 9 hospitals and 7 step-down facilities for recovering patients. The information provided this afternoon is as of 8 a.m. on the 19th of June 2021. This graph demonstrates the rolling average, and as of today, the rolling average is at 252. Now, the rolling average is the average number of positive cases over the last 7 days, and it serves as a guide to the number of persons who really require care. So we expect that if the rolling average is decreasing, less persons would require care. I'd like you to pay attention to the 26th of May, because on or around this number, the rolling average peaked. And then we saw a very slow decline. And again, the key word here would be a slow decrease. And we've noticed that consistently over the past 3 weeks. This is a graph that demonstrates the the number of cases in terms of the admissions, as well as the number of admissions and discharges. Now, this graph demonstrates that over the last week, the gap between admissions and discharges is decreasing or is narrowing. That is relevant because it means that there are less extra patients in the parallel healthcare system during last week versus this week. So the parallel healthcare system is really less burdened this week as opposed to last week. And I'll demonstrate why we noticed that trend. So over the past month, you would have noticed an increasing number of admissions. And this increasing number of admissions was not just attributed or due to an increasing number of cases, but it was due to the increasing number of facilities with resources such as beds and nurses and ventilators that were being operationalized across the parallel healthcare system. Now, last week we noticed a large gap, and this was demonstrated, of 187 extra patients over the week versus this week where there are 152 extra patients. Now, the reason that we've seen a decline last week to this week from 187 to 152 is because, as you can see here, there were more patients that were discharged in terms of that proportion. Now, of course, that would indicate patients who are well. The net effect, again, of this admissions and discharges equation is a reduced burden on the parallel healthcare system as compared to last week. We are now looking at the number or the actual number of COVID-positive patients that are hospitalized in the parallel healthcare system. And yet again, I would like to draw your attention to on or about the 25th to 28th of May, where we saw a peak, just over 600 patients in total, and then a flattening or plateauing off. So this graph demonstrates not just the hospital. When we say hospitalized, we speak about 16 centers, 9 hospitals, and 7 step-down facilities. And the total number of patients as of today is 590. Now, the total number of patients ranged over the past 2 weeks, from the past few months, from basically 573 to 638. And that is a very narrow window in terms of the spread across 16 facilities. Now, what would be important to note is if we separated the patients in hospital, who are the more ill patients requiring a higher level of care, more nurses, more doctors, oxygen care, that number is greater compared to those who are recovering. So we still have a larger proportion or larger number of sick patients. Today it's 449, and over the past 3 weeks, it went from 428 to 494. Now, this is a percentage graph, and I'd like to explain it because the occupancy is actually a measure of the total number of hospital beds that are occupied over the total number of hospital beds that are available and resourced. The occupancy is the measure of the ability of the parallel healthcare system to care for COVID-19 patients. And over the past 2 months, we have added beds and we've added institutions to care for these patients. So the actual availability of beds has increased. Now, in Trinidad and Tobago, based on our population, the bed availability is about 90%. What we can note on or about that week with the 26th to 28th is that the overall occupancy, again, is slowly declining. There has been a very slow trend if we look at the general curve. And today, our overall occupancy is actually 57%, and over the last 3 weeks, it was between 57 to 64%, so slow decline. If we separate the number of persons that need care over the beds we have in Trinidad and Tobago, we will notice that the overall occupancy as of today is 60%. So basically, 6 out of 10 beds in the entire system are being occupied. The average over the last 3 weeks was 62%, which is close to what we've noticed in Trinidad, and it dipped at 57%. Now, there are 7 hospitals in Trinidad and Tobago that are responsible for the care of the critically ill and more sick patients, as we would say. So these are patients that require oxygen therapy, ventilators in the intensive care unit and the high dependency unit. They require a higher number of nurses managing them, and again, oxygen therapy via various number of means. So in week 21, which was on or about May 31st or so, we would notice that an additional bar has been added, and that's when we added the Point Fortin Hospital, which had a bed capacity of approximately 75 beds, which included HDU and ICU, 71 ward beds, and 4 ICU or HDU beds. So you'll see an additional hospital added there, which meant the number of beds available and the capacity increased. Now, what you would notice is that we've generally been seeing 4 out of 7 of the hospitals above the critical zone of 75%. And it again demonstrates that there is a larger number or proportion of more sick patients, and these hospitals are more filled. Now, when we look at the 7 step-down facilities, as of this morning, only one of the 7 step-down facilities is above the 75% threshold. So the number of recovering patients is still lagging behind the number of actual ill patients. This looks at the occupancy overall, which is the number of persons in each level of care. And we have what is called, or I've identified as level 1 care, which are the patients who are not well, they require observation and require to be in the hospital. And then we have what is called level 2 care, which Dr. Trotman and my colleagues always speak about, a high dependency unit care, where that patient is stepped up to receive oxygen and they have greater nurses, etc. Level 3 is the most resource demanding level of care, which is an intensive care where they are ventilated, they require dialysis, and so on. And again, what we are noticing here is that the overall ward occupancy, where we initially had the greatest demand for beds and added hospitals, has again had that downward trend from or about the 27th or 28th of May. So I'd like you to remember that date because that's when we started seeing a curve, and it corresponds to what Dr. Hines would have been speaking about. Now, the average ward occupancy, which is the largest number of beds, is 55%. So about half of our available ward beds are now filled in Trinidad, as opposed to what we saw at one point when we were speaking about, number of bed days. Now, as far as intensive care units and high dependency units, the intensive care unit ratio or percentage is at 76% today, while the high dependency unit percentage is at 100%. Now, I'd like to make it clear that it does not mean that we have no more beds. I'd like to really reiterate that it means as of today, we can actually transition between ICU and HDU, and we do have the available resources in terms of ventilators and the consumables and monitors to actually increase, which is what we've been doing. We've been converting ward beds to ICU and HDU beds based on the demand with that supply and demand curve. One of the reasons that we instituted the parallel healthcare system on March 12, 2020, was to preserve the integrity of what is called the traditional healthcare system. That is a healthcare system that takes care of persons who do not have COVID, our grandmother who has hypertension and diabetes, our wife who is pregnant. We did not want the parallel healthcare system to overwhelm the traditional healthcare system, because then people would have died not just of COVID, but of other preventable conditions. Now, I'm looking here and referring to the accident and emergency departments in the traditional healthcare system by the RHA. So ERHA would be Eastern RHA, which covers the Grande Mayaro area, Northwest RHA, generally the Port of Spain area, the Southwest RHA from Freeport down into the Southern Peninsula, and the North Central RHA, which really looks at the East-West corridor. Now, at each RHA, there are different A&Es, or accident and emergencies. And we have noticed that on or around the 5th of June, there has been a plateauing or a general decrease in the number of persons in the accident and emergency at 8 a.m. in the morning, which tends to be the highest number from overnight cases, awaiting transfers. And this is a promising trend. We continue to see North Central, which is the traditional area that persons would go to for COVID treatment and has a high population, somewhere in the vicinity of 20 to 25 persons every morning across the Arima District Health Facility, the Chaguanas Health Facility, and the Accident and Emergency at Port of Spain General and St. James Medical Center. It's interesting to note and noteworthy that the Southwest RHA, which has a catchment population of about 600,000, has been able to maintain a general decline. There was an uptick yesterday, which is an anomaly, but generally they have been able to have less than 10 patients across the accident and emergency centers in terms of the San Fernando General Hospital, Point Fortin, and Couva. Northwest is still somewhere in an intermediate number with an average of about 20, and Eastern, which is a smaller RHA, is in the vicinity of about 5 in terms of average per day. So we are seeing less burden on the traditional healthcare system because, of course, in the accident and emergency room, you would have to separate your staff and separate physical space to manage these COVID-19 patients while we are waiting on an ambulance transfer. Another area we look at in terms of a precursor indicator would be the ambulance system. Of course, the national ambulance system that we use would be the GMRTT system. And at one point, we were noticing that about 50% of the available ambulances were carrying COVID patients. That is patients who came from their home to the A&E between the accident and emergency and the Cuba hospital or any other hospital, and so on. Now that, I'd like to reiterate here that it is not we're not saying that we allocated 50%. It means that when we look at the total number of trips per day, 5 out of 10 ended up being COVID transports. Again, over the last week, we've seen a variable trend, but if we look, there's again a very slow decline down from the 50% to the 40 to about 30% on average. So 3 out of 10 transfers nationally on a daily basis to 4 out of 10 transfers are now due to COVID-19 patients who are ill. Now, the turnaround time, that is the time from when a patient makes a call for the ambulance service, and they are taken, collected, and taken to the hospital and assessed in the accident and emergency and dropped off, has decreased and is stabilizing. And that is tied to a decreasing number of ill patients and active cases at home. Again, it's been a very slow decline. We are in the vicinity of about 150 minutes. This may seem long, but a COVID transport takes significantly longer than a normal transport because of the level of sanitization, the use of personal protective equipment, and other resources. Again, COVID patients require much more significant resources than patients in the parallel healthcare system. And so we need to really be stringent in terms of how we manage ourselves and manage these patients. In closing, ladies and gentlemen, we have noticed a slow decline, and we must not be prematurely comforted by this decline. The Ministry of Health continues to do all in our part to save lives, both in the traditional healthcare system as well as the parallel healthcare system. We continue to increase beds and allocate beds and ensure that a level of operational efficiency is managed. But you, Trinidad and Tobago, need to help us. How do you help us? We continue with the 3 W's. We continue to wear your mask. We continue to wash your hands and watch our distance. Thank you very much, everyone, and have a happy Labor Day.
Thank you very much, Dr. Richards. Minister Dayal Singh will now take us through the information with respect to the vaccination program and how we're doing there.
Thank you very much, Honorable Prime Minister. Good afternoon to Minister Young, Chief Medical Officer and his medical team. Good afternoon to ladies and gentlemen of the media and the viewing and listening public, wherever you are. Happy Labor Day to all. So my task this afternoon is to walk you through the up-to-date figures as it relates to our vaccination program. On the slide in front of you, we'll give you the total first dose broken down by RHAs, the 5 RHAs, North Central, Northwest, ERHA, Southwest, Tobago. Other state agencies that we are vaccinating, like Ministry of National Security, Ministry of Works, Central Bank, and those agencies. And other agencies, which will be the private sector that we are partnering with, Supermarket Association, Manufacturers Association, construction, bankers. On Thursday, we did 1,900 approximately in the banking sector. Yesterday, we did approximately 1,900 again in the private security sector. So the total first dose to date, as of last night, 176,849 across all of those 5 RHAs and 2 agencies. Total second dose to date across the RHAs. The second dosing has not started yet in the other agencies. That will depend on the time lapse between first dose and second dose. But the total second dose to date, 39,142. You may recall when we started the second dose national rollout on June the 7th. At that time, it was 1,179. which represented those healthcare workers who got their first shots back in February. So between June 7th to now, we have moved from 1,179 to 39,142. The second slide, right, shows you what our initial targets look like. So goal 1, which can change as we get in more and more vaccines, was to have 188,900 persons fully vaccinated by July 31st, 2021. Fully vaccinated means you must have your 2 shots, whether it's the AstraZeneca or the Sinopharm. So that's the horizontal purple line. That's our initial target. The green line, which is moving close to it, represents the 176,849 who have received their first dose. So we are on target for the first dose to meet that horizontal purple line in a very short space of time. The aquamarinish bluish line, I hope I got the color right, is the 39,142 second dose. What will happen to this line? It will get more and more upright, more and more vertical as we start to vaccinate more and more people with their second dose, pending 8 weeks after they got their AstraZeneca doses or 3 weeks after they got the Sinopharm doses. So the area of focus now is not only on first dose, but really getting that aquamarine line to actually get vertical and meet up with the horizontal purple line, and that will give us our first goal of 188,900 fully vaccinated people. Just to bring the national population up to date on our activities for the last week, when we were focusing on persons 65 and over. And we started the mobile DHV unit visits to homes for the aged. Well, continued it really. In Tobago, and speaking to my colleague this morning, the Secretary of Health, Wellness and Family Services, they were able to do 37 persons this week. But the Honorable Tracy Davison Celestine has asked me to make a particular plea on national TV today that the take-up is particularly low in Tobago. They are not getting the required consent from the guardians, legal guardians, or children of the elderly in Tobago. So she has asked me to make a particular plea this afternoon for those elderlies in the homes in Tobago, the long-stay homes, that they need the consent to vaccinate the elderly in Tobago. In Trinidad, with the program continuing with the elderly homes, we have been able to do 388 for this week alone. So for this week, between Trinidad and Tobago, we have been able to do 425 elderly, which isn't a bad place to be. With the over 65 program, which we started this week, I will now give you the figures for that program. This is started on Wednesday, so the Wednesday, Thursday, Friday figures. Eastern RHA would have done 1,011. North Central RHA, 1,410. Northwest RHA, 1,001. And Southwest RHA, which is the biggest RHA in terms of population, as you heard, is over 600,000 persons, 1,833. So with the over 65 program this week, we have been able to do 5,255 across the 4 RHAs in Trinidad. So that is where we are with the vaccination program. We are urging all persons, and the program is going particularly well. I'm getting very good reports that people are receiving their calls for their second shots, but the call still goes out. When you get your call for your second shot, you are only considered fully vaccinated when you have your second shot. So please, ladies and gentlemen, make use of the second shot at the facilities you are being called to. Okay? Thank you very much, Prime Minister.
Thank you very much, Minister Dayal Singh. I just want to re-emphasize and clarify something with respect to the data about the target that we are aiming at. And he said that we had that horizontal line as to where we want to be. That line where we aim to vaccinate 188,900 persons by that time is entirely controlled, not by any target that we had set for the requirement to vaccinate. It was set by the vaccines that we had been able to access. So that 188,900 represents 377,000 doses. That's the vaccine that we have been able to get our hands on from all sources during the period which was covered by the vaccination. However, as we get more vaccines, that target will change depending on how many more vaccine doses we get. So I want to make that very clear. That figure is not a figure cast in stone, and it wasn't set by us as any requirement. The requirement is different. And I want to get to that now because I'm seeing some conversations developing, and I would like to make sure that the government's position is very clear. From the very beginning, the policy of the government of Trinidad and Tobago has been made very clear from this podium and elsewhere that we will respond to this virus, the novel coronavirus, based on our understanding of the science of how human beings are affected by it and how human beings should respond to it. We will respond through the science. That's the government policy number one. That took us to the department that has the responsibility for receiving that information, advising the government, and getting the population to respond based on the science. Arising out of that understanding, the whole world, the scientific population of the whole world, of course there will be persons who are scientists who don't agree. Some people still believe that the world is flat, and some believe that there's hell below and heaven above. But the vast majority of scientists in the world have said that what the human population in whatever nation you may reside, what you're required to do is to get vaccinated. You may recall that before we had news of a vaccine that was efficacious, one that was affecting the virus in our body, getting a response, there was a pretty widespread element of hopelessness as to how do we get out of this situation from this virus that was rampaging across the world. And many of you would have visual memories of what was happening with respect to death and sickness and so on. Vaccination became the objective. Get the population vaccinated, and to do that, scientists around the world were asked to get a vaccine or vaccines. And of course, the gene sequencing was done in many areas, and the very first notice we got was at Oxford University, and others had got it done, and soon after others had got it done. The bottom line is, vaccination is the objective. And then we got into the phase of access to the vaccines. As the vaccines were given emergency approval authorization, there was now a rush to get your hands on the vaccine. Many people around the world have not yet got their hands on many vaccines. In Trinidad and Tobago, we have got our hands on approximately 377,000 vaccines. That's what we got our hands on. It is not that we got other vaccines and they're hiding somewhere, or we have more to come and we didn't get it and so on. With our best effort from day one, making our best effort, so far we have been able to get our hands on that figure, just under 380,000 vaccines, and they have been utilized in the way the minister has described. And because it's a two-dose arrangement, the management of that is what you would have seen, and you can't just give the second dose the day after the first dose. Depending on the brand of the vaccine, you have to wait for a particular period between the first and second dose, and that's what you've been hearing there about. Now, once the vaccine science became known to the world and vaccine became put into use, the third policy of the government was to use vaccines that have been given at least emergency use authorization by the World Health Organization. That is the body that has advised us on all the vaccines that we've been using, because this vaccine for this virus is nothing new process-wise. It is new with respect to the actual item that is in the vaccine. But vaccination and the receipt and use of vaccines in this population has been something that was common amongst us, particularly for children and, of course, for adult travelers. Those of you who would have traveled would have known that you would have had to have your yellow fever vaccine or your hepatitis vaccine or diphtheria for children and so on. And, of course, we were not as well educated as we are now, and we didn't have social media and so on, and therefore the brand and the shape of the bottle and all of those things didn't matter. You took your child to the community center, got vaccinated, and in fact, to go into schools, there was a requirement, a forced requirement, that children had to be vaccinated to come into the school population, not only for the protection of those children, but for the protection of others. So therefore, all of you who are parents or guardians of small children, or parents who gave birth, would know that within weeks of the child being born, there are certain vaccination regimes that take place. So our national policy was that as soon as WHO gives its stamp of approval, that comes in two forms. One, an emergency use authorization, which is proceed in emergency, and later on, as you get more and more comfortable with it, a blanket approval, which means that it could be on the market as an open market product. And that's where we are now with respect to getting and using some vaccine, small numbers, because we would love to have got more vaccines, but for the nth time, they aren't available. So what I did was to ask the leaders in this country, whoever you are, wherever you are, and I'm going to do it again today, ask the leaders, whether it's a cricket club, a religious body, or whatever, the national policy is to get vaccinated, and you would do well to help us with that by encouraging and asking your flock, whoever they might be, to get vaccinated. That is against the policy that the vaccination program is voluntary. So we need not go off in any tangent about anybody forcing anybody to be vaccinated. It is that since we have followed the science and followed it through the authorization of the WHO, the product that we're going to use, and we understand that to manage and live with this virus with some element of success, that vaccination is the way to go. The national policy is to encourage people to get vaccinated. We know that there are people out there for one reason or the other who don't want to get vaccinated. But what I'm not going to get involved in is any discussion about, especially if it is contrived, about the people who are not going to get vaccinated, other than to convince them that there's a science behind this and there's a requirement for the national population to treat with this virus. And that requirement is to get as many people as possible vaccinated, and that is called herd immunity, meaning that a large number of people in any population is vaccinated, and therefore you get the upper hand of the virus with respect to its propagation in the population. I would not be surprised if in the coming days or weeks or months that I or the government or whoever else is be accused of calling human beings cattle, because the word that we're using is herd immunity. And of course, you know from primary school that a herd is a herd of cattle or a herd of buffaloes, or what the case might be. Because people look for all kinds of reasons to get in on the act of trying to make an argument about something. But from national policy standpoint, nobody is forcing anybody to use this vaccine. But we're saying that you have to regard every other person in the protocols as either carrying the virus or you yourself carrying it. And that's why we have these wearing of face masks and the distancing and the hygiene restrictions and so on. So it's important to have that, because we may find ourselves going down a road missing the main reaction from the population, and that reaction has to be, once we get the vaccines that we have been striving for and looking for, get vaccinated. The government policy does not go beyond that at this time. Get vaccinated. I'm very pleased. I have seen leaders like Archbishop Gordon asking his flock and the national population to try to get to this target. I've seen Maulana Soleimani and other leaders, and I've also seen other leaders making different arguments. And I am not really, I'm hoping that the national population would benefit from increased inflows of vaccines, and we will vaccinate and get the benefit of that. Because so far, the reports from around the world is that those populations that have managed to get vaccinated have got benefits from it. That is not to say that new difficulties have not arisen. We have never said that you get vaccinated and it's going to cure you or prevent you from getting COVID, or if there are variants in the growth of the virus, that you will not have to sometime later on respond to that. Because we've seen in one particular country, which was very heavily vaccinated, they're now fighting a variant which might require the whole population to get revaccinated. That's one side of it. We've seen another population elsewhere that was vaccinated by some of the brands that we're using here with very, very good results. So therefore, we are going to vaccinate and expect to get the benefit of that. So as Prime Minister of the country, following those 3 or 4 policies there, I'm staying with that and I'm asking you, 1, we are science guided. 2, we expected to. We got vaccines in the scientific community. We got some vaccines, and we're in the market for more. We're vaccinating. And, of course, our vaccines are WHO approved for emergency use. And, of course, we will then accept, as we must, that we are living with this virus. It is not the intention of the government to keep this population at home unnecessarily for any protracted period of time. We did that to be able to blunt the spread of the virus through our population, which could have and would have had devastating consequences. We've suffered a number of losses of life, 1 being too many, and of course we moved very quickly from low levels to fairly high levels, but this is the pandemic of 2021, and we're hoping to get out of it with the minimum loss of life and, of course, minimum dislocation. Last week, I did tell you that it was our intention to make certain adjustments, starting with populations, because remember, we are vaccinating by cohorts, section of the population. It's a management tool, and it's also getting the vaccines to those who are most exposed. So those 2 things together, helping us to what little vaccines we got, primarily for those who are most exposed and who need it most, and secondly, use the sectors that we can vaccinate and aim towards getting back to some economic activity and community involvement. And that is what guides this policy of vaccinating by sectors. And also, that allows us to bring in the private sector, which is now very much involved. Private sector involvement in the vaccination program for the vaccines we had in hand has been and continues to be very useful, and will continue so to do as we go forward. Because I said last week, based on what is happening in the international community with vaccine availability, I do not expect that we would have enough vaccines in our hand at any one time to do the simplest and straightforward thing, which is to put it all in the health centers and say, come at your pleasure and get vaccinated. If that happens, we'll be very pleased. But right now, the way we are being able to access vaccines it appears as though, as I said last week, we will get our vaccines in tranches and we'll manage each tranche into the population in the way that we're doing now and in any improved way. I'm pleased to tell you that after last week, after what happened last week, Wednesday into Thursday into Friday, we did pause. We started on Wednesday, and notwithstanding 1 or 2 hiccups here and there, including a shower of rain here and there, all the reports I've had have been that the system has worked well, and those who were encouraged to come out were given good service, and we think that we have gotten over that, and we now know what we will do going forward as we get new vaccines. What is likely to happen, and I'm saying this now because I know that it is likely to trigger questions and concerns. We don't have any control over what vaccines we get and when. We are still out there trying to get more vaccines. The vaccines that we have in hand now will keep us busy until into early July. But in terms of giving people their first dose, we only have enough vaccines in hand now to keep us busy for the next 2 weeks. Within the next 2 weeks, we would have used up, at the rate at which we are going here, we would have used up all the vaccines that we have in hand for use as first dose, which means that if we don't get a new shipment by the end of the month, we will not have vaccines to give anybody a first dose. And once that is clear, then I don't expect people to come and say, well, why you stop vaccinating? Carry on the vaccination program. You need to vaccinate the population. That is unnecessary. We can only vaccinate with vaccines. So at the end of this month, I expect that every vaccine that we have, which is available for our first dose, would have been utilized. And the earlier, the better. But the vaccination program continues because we have in hand vaccines to give people their second dose. Those people who had already got their first dose would get their second dose. That will take us into about the first 10 days or so of July, mid-July at worst. So by that time, the 377,000 vaccines that we would have had would have been completely used up both in the first and second dose. So we now should keep our eye on the next shipment. There are 2 shipments that are likely to be on the way. One is our third COVAX shipment, which has now, I'm advised this morning, has been delayed again towards the end of...
It will be sometime in July.
Well, sometime in July means the end of July, because that's the outside time. It looks as though sometimes towards the end of July, if there are no further delays from the COVAX end. And ladies and gentlemen, that has nothing to do with the government or the Prime Minister or the Minister of Health. We are no recipients of that. So sometime towards the end of July, which would be, if we say we have used up all that we've had by the second week of July, it means there'd be a little period in between when there's no vaccination going on because we have none for first dose, none for second dose have been done. So we're now waiting for the next shipment. From the COVAX end, it's likely to be towards the end of July. And that is at 33,000 doses, which hopefully doesn't get reduced in the process. So we're looking, and if we get that, that would allow us to vaccinate 16,000 people or thereabouts, and we could then do some first dosing with that. We also are continuing our purchase from China, and we expect that there would be another shipment in July in the order similar to the one we just got, or a little bit more, and we wait until we get the shipment documentation on that, confirmation on that, to tell you more. But that's the other source of vaccine that we have in the pipeline, another shipment of Sinopharm. So if things go according to the plan that has gone so far, we should have 250,000 doses during the month of July to restart the program mid-July going forward. And ladies and gentlemen, that is Trinidad and Tobago's position right now. Additionally, we still are on track with our African Medical Supply Platform expectation, but remember that's an August. That's an August shipment we're looking at. That's not in July. And of course, the fourth prong is the promise from the United States to share their vaccines, and we have not seen anything beyond that so far. We don't know what will come through, and I may add one more caveat. We don't know if we'll qualify based on what yardstick they'll be using for distributing that vaccine. So that is at tier 4. So tier 1 is the COVAX towards, I would say, the third to fourth week of July. Another shipment of Sinopharm towards middle to end of July. And of course, the African Medical Supply one, Johnson & Johnson, sometime August going forward. And that is our prospect in vaccinating. But in the meantime, as of today, we would have been under a state of emergency for a few weeks. We would have been under interventions of one kind or another for a few more weeks than that. And let's look ahead and see what's the prospect. Based on what I just told you, and based on what Dr. Richards told you about our hospitals and what Dr. Hines told you on our statistical numbers, and of course, most importantly, what Dr. Trotman will tell you when she comes after there, we are now required to take this bull by his horns, living with the virus. It is my intention, if there is no significant reversal of our situation, to next weekend, which should be the last weekend in June, what we had promised to do at the beginning of June, we will do, meaning that I did ask you to stay in tightly on weekends, including the weekend which happened to have had in it Labor Day, had nothing to do with any attack on the labor movement. We have one more weekend to do that, staying in. Next weekend, we'll repeat that. That's the weekend of the 25th of June, and hopefully, it is my expectation that that will be the last time we do that under the current arrangements where we start our curfew on Friday evening at 7 o'clock and go the way we have gone this weekend. So we'll do that again next weekend, and unless something drastically wrong appears, we will then not do it that way. We'll then, more than likely, go back to the more relaxed curfew arrangement, if that is a good thing. And so therefore the weekend of the 3rd of July, which is the first weekend in July, we should be a little different and go back to what weekends were before this early weekend. Now, in terms of coming out cautiously, the next action that we are likely to take, and I'm using the word likely, is bringing out the construction sector, and I trust by then a significant number of construction workers would have been vaccinated. And so the population of Trinidad and Tobago would see increased movement and exposure from those persons who are in or associated with construction. So this would be the construction sector and its associated business, because, for example, if we bring out the construction sector, we have to open the hardwares. And we also have to open those manufacturers that are making paint and making doors and so, to make sure that things go smoothly. So that is the first group of people who we expect to come out. And next week when we meet, I expect to be able to tell you that construction reopens the following Monday. So you could begin to think and plan along those lines and cooperate to make it operate. If that goes well, that would be our cautious arrival. And then we said to you at an earlier time that we are taking steps to reopen our border with some caution and conditions, and that would take place in the second week of July, right? Somewhere around the second week of July. We are still on track for that. we still expect to be able to do that. Cal and the ministries have worked out the arrangements, and during the coming week, the relevant authorities will tell you what the conditions are, and we are preparing to have scheduled air service into Trinidad and Tobago and operate the managed border. The open border is not a free-for-all. It will be a border which will be open for activities. The most important thing would be there will be scheduled arrangements, and persons who are vaccinated as against who are not vaccinated would be treated as groups of people with different conditions. And I trust that the conversation that I see developing there, I trust that you understand what is happening outside right now. Even with heavily vaccinated populations, we are not out of the woods yet. You would have heard about the Delta? The Delta variant in the United States and in the UK, which was really the variant that came out of India. We had the India, South Africa, Brazil. We are dealing with that now. So even as we are opening, we have to keep our eyes on that, because we have seen what's happened in other populations, and therefore you will be given guidance by the Ministry of Health and the Ministry of National Security and the Ministry of Civil Aviation, Transportation, and so on. And of course, after that, the next horizon we'll be looking at, now that the border opening and the construction go together, but they're not linked. It's the same time frame. But remember that these will be two flows of population movement in our society. So we then are going to be so much exposed. We're going to be exposed to the importation of that Delta virus from North America, which is where most of our traffic will be. And of course, we will be exposed by having so many more people out there. And hopefully those people out there would be largely vaccinated or significantly vaccinated, but more importantly, behaving in a responsible way. I must tell you, I am still amazed at how the average person in this country is still not yet behaving responsibly. You are in a line. You don't have to be on top the next person's shoulder to be in the line. You could be 6 or 8 feet away and be in the line and be in the line safely. I've seen some pictures of people coming to the grocery or going to pay their WASA bill. And because it's a WASA bill you're going to pay, or because you're going to the grocery, you completely forget that there's something that you have to do to save your life. Please don't forget, there's always something that you have to do to save your life. That is primary. Everything else is secondary. Your place in the line is secondary. A line with a crowd that you can't tell who is in front of who is just an uncooperative line. So you have to bear that in mind, especially now that we're saying livelihood is coming close, action for lives. Because remember, two things we have to do: livelihood and lives. The last month, lives to paramountcy. Livelihood is going to join you. We are taking more risks, and therefore we expect greater cooperation while we source more vaccines and vaccinate more people. Once we do that, and we are comfortable that we have not created any incipient disaster, the next group that we will look at will be made known to you, and we'll do the same thing. So we go on a step-by-step basis, and until eventually we hope to get to the point in September, towards the middle or end of September, hopefully, that we're talking about children going out to school. That is, if all goes well. But you've seen what has been happening. Things may not go well, and therefore you don't despair, you don't get tired. We just have to respond, and respond sensibly. So those are the programs we have in front of us, and today we go forward from there. If you have any questions, we'll take them now. Identify yourself and we'll take your question.
Good afternoon, everyone. Kimberly D'Souza from TTT News. Prime Minister, you've been looking ahead, so you're thinking in terms of maybe removing the curfew, opening the construction sector, and of course the reopening of the borders. Can you tell us if the July 4th restrictions will still stand? The July 4th lifting of those restrictions?
July 4th.
That will be adjusted.
Well, I didn't mention the curfew. I said the extent of the curfew. And I said that next weekend, the last adjustment we made for extended period on weekends should be the last of it. And then after that, we go back to the normal curfew weekend, where your curfew starts at 9 o'clock, as against 6 o'clock. And but of course, I'm saying that, hoping that things stay, on the same trajectory that we are on now. If the trajectory changes drastically, I will have to say something else. And with respect to the state of emergency, we hold on to that for a while longer until we can see clearer. So that remains in place for a while longer. As we go forward, we get to see further down the road.
Health regulations, that's what
You mean the health regulation? All right. You clarify that for the.
Good afternoon, Prime Minister, Minister of Health, CMO and colleagues, media, all listening, public of Trinidad and Tobago. The question you're asking is really, you'd recall at the start of the state of emergency, we separated the regulations. So there's state of emergency regulations that govern essential, non-essential, the times during the day, curfew, etc. That is something separate. As we went to Parliament, that will continue until the end of the state of emergency, unless the Prime Minister determines prior to that. We also separated out of that public health regulations that have the 4th of July date. At the time when we were setting that, and that is for mandatory mask wearing, that is to do with the border control by the Ministry of National Security, and some of those other public health that we carved out and kept separately. So that's something we will look at when we meet with the Prime Minister and with the Minister of Health and the CMO and his team. We will also take a look at that, because one of the things that will have to change, but we may have to extend beyond the 4th of July, for example, is the borders. You've heard the Prime Minister, the date we're looking for a change in our border policy is the middle of July. So by definition, that takes us beyond the 4th of July. So it is very likely we'll extend that, because that's the mandatory mask wearing. That is when you're in a car, you have to wear your mask if there's more than one person, and other public health regulations separate from the state of emergency, Prime Minister. So the answer is yes, we are likely to extend that depending on how things are going at the time.
Thank you for that legal clarification. I always defer to the lawyers. Might not be a good thing, but it's an expected thing. Yeah, so as I'm trying to say, we are going to be making these adjustments, but it's all going to be governed by the state of the infection level at the time the decision has to be made. Hopefully, we can make these decisions for improved arrangements, assuming that the infection levels would have been improved. Okay?
Just want to follow up on that question a little bit. The next weekend, could you just clarify that for me? Would we be imposing the same thing that we have this weekend?
Whatever happened this weekend, if you recall, at an earlier time, early in June, I said that the weekends in June, we will make certain adjustments to allow the curfew to require people to stay indoors longer. So
Is it 7 p.m. to 5 p.m.?
it is the curfew that starts earlier at 7 o'clock on a Friday afternoon and goes until 5 o'clock in the morning of the following day, and then comes back into effect on the 10 o'clock and goes that way. That is the one that we've been doing for the last 2 or 3 weekends. What I said was that the next weekend, we are going to do that again, and hopefully for the last time. And then what will be in place would be the curfew that begins at 9 o'clock, which is the one that you had been accustomed to before, if you could ever get accustomed to a curfew. But that's what I said. So the changes made for the month of June on the weekends, when June ends, those special arrangements for the June month, hopefully the first weekend of July, July 3rd, would be a weekend where there'll be a curfew, but it will start a little later, and it will not confine you as much as how you were confined in June.
Prime Minister Joshua Simonga from Guardian Media. Prime Minister, you made mention of the possible donation from the American government. Is it that they promised vaccines outright, or is it subject to qualification? And
I can't answer that now. You and I have the same information, and we have had a lot of conversations, which are confirmations of the public information that the United States government and the EU has also agreed to put more resources into COVAX. So it is likely that somewhere down the road, the COVAX supply could be improved. And also the United States made two announcements. One initially was of 80 million doses of vaccines for distribution, and then later on an additional 20 million, something like that. But so far, we do not have any information as to what the allocation is going to be and what the conditions are going to be like in terms of volumes and so on. So we just have to wait and see what comes out of there. But in the meantime, that's why I say it's a tier 4. We have tier 1, 2, and 3, where we have other sources of vaccine that we are aiming to use, and if others come along, we'll be very happy.
In the opening of the borders, in the U.S., I saw reports of people buying vaccine cards, fake vaccine cards. How would the government treat with that?
Well, that is an operational aspect of things. People print money. So that is not to be surprising to anybody. People print US dollars. They print TT dollars. So you just have to put things in place to ameliorate or minimize that kind of action. But there will be certain kinds of requirements, and if documents are forged and they are sufficiently well forged, there isn't much we can do about it unless you say no to everybody. But we believe that the vast majority of people will be using legal documents, and that would be what we can have to pitch. The parameter will be pitched at that.
On the same vaccine issue, there are some countries not accepting citizens who are vaccinated by certain vaccines, certain brands of vaccines. How are we treating with that?
You remember when AIDS was the big thing in terms of human infection? And there was a period of time when if you came from Haiti, you couldn't enter certain countries because you were supposed to be a Haitian virus. These things will work their way through, right? And if countries take decisions like that, there isn't much that we could do about it, right? But our policy of once the vaccine is carrying the authorization of the WHO, we will accept it, right? And it wouldn't be a preference situation. The yardstick by which you will be allowed to use it here in this country is that it must be one that is a WHO approved vaccine, right? And of course, if our people go abroad having used WHO vaccines, right, we will then, because you see, if you don't do that, it becomes unmanageable. Because you have someone that have been vaccinated with a vaccine and call a name. What are you going to do? Says you don't have any information on it. You didn't do any tests on it. Nobody has certified it. So you can't just say, okay, since you say you're vaccinated, you go ahead. That makes a nonsense of the whole thing. So you have to have some kind of arrangement as to what is acceptable and what is not. And of course, I started out by saying that we have a policy in this country which is in place. And of course, the policy can be adjusted because there are vaccines, but they all would have got, the ones that are being used in the countries that we would expect to get people to come to us from, the emergency use vaccinations, right? If those are the ones, then we haven't got a problem. On the other hand, we have to come up with we have to respond to people who are coming from other areas where they say, I've been vaccinated with X, Y, Z. How do we treat with that? And the answer is, we have to be guided by the WHO emergency use authorization.
And the flip side to that is some countries not accepting locals who have been vaccinated with some.
That's entirely up to the country that is doing that. We can only speak for what happens in Trinidad and Tobago. And when our nationals go abroad, wherever you're going, you will have to subject yourself to the conditions that they have laid down.
Just for clarification, persons who are not vaccinated will be allowed into the country when they go
under different conditions to the ones who are vaccinated. Right? But you'll get more details a bit later on.
Prime Minister, there's been significant data collection from our medical and health side of covering the pandemic. Is the government conducting assessments of the socio-economic impact in communities, particularly poorer communities?
Well, different government departments are engaged in that kind of work, and eventually it will all become put together in managing government's policy going forward and managing the economic aspect of it. But I mean, the Ministry of Finance departments, the Central Bank, the Social Services Department, the Ministry of Health, they all are going to have databases on this, and then you put them all together and create, it's like strands of a rope, and that will give you an idea as to what we do.
Would that leave room for possible increased social support systems? First of all, do we have the finances to be able to increase those?
Well, the finances are very, very limited, and that's why we are prioritizing it. And of course, the thing about Trinidad and Tobago, we already had in place a very large social support system. That is something that ought not to be lost on the population. Before the pandemic, Trinidad and Tobago, unlike many countries, we have a very large social support system, from non-contributory old age pension, covers a lot of people, people who who are miscellaneous, people who have disabilities, support for orphans, support for people who have lost certain arrangements. We have a national insurance system in place. So about a significant portion of the national budget goes into subsidies. Those subsidies are in fact social support, or they're meant to be, but because they are broad-based, they support everybody. Right? But in Trinidad and Tobago, your water rate, your electricity, your transportation between the islands, your hospital care, all of these things are already taken up by the state. If you look at the United States, the richest country in the world, the biggest problem for anybody earning money in that country who's not a millionaire is your cost for healthcare. You know. In Trinidad and Tobago, healthcare is provided by the state, and most of the population take it for granted and demand more of it and badmouth it as often as you could. But that is a major contribution from the state. School children are supported by the state fully, from ECC to university. So already, to answer your question, the state has picked up a huge amount of what needs to be picked up, even in a pandemic. And now we've gone further by doing more than we normally would do, by getting additional support to people, literally providing food on the table. Right? Because one of the major exercises we're engaging now is to provide foodstuffs to households, so that nobody should be able to say, I'm in Trinidad and Tobago and I have not known where to look to get a meal. Because we do have certain things in place, either directly through the state, through the churches, and so on. I mean, when you reach the point where an opposition MP could be crying and telling you he handed out 600 hampers in his constituency, you know that there's something in place. Okay?
The private sector has done enough?
Well, the private sector keeps doing as much as it could. There's always room for further, but you must remember the private sector also is beaten down by this pandemic. A lot of the private sector earnings have been negatively affected by a number of factors arising out of the pandemic. They too, in some instances, private sector businesses are tottering on the closure, or struggling to keep those people who they keep on the payroll. So it's not as if they have a pool that they could just share it out. In fact, you would observe they are calling on the government in a similar vein to provide assistance to them. And significant assistance have come to the private sector from the same pot of the state's consolidated fund.
With the opening of construction, construction and street food go hand in hand. What's the consideration for takeout from restaurants, opening of street food?
House food. For a few weeks, I presume. Eh? You can't have it both ways. If we do that and we capsize the arrangement and Dr. Hines comes here and tells us that we got a redoubling and Dr. Richards comes and tells us we have no beds in the hospital, street food gone, you know. Right? So what we'll suggest for the period when there is no street food, make a sandwich at home, put your pot on fire at home, at least for a little while. And then we will get to the street food stage where when we bring out street food, it doesn't pose that additional threat and risk. It's a management of risk, which you manage by the reduction in the number of people. We'd love to have everybody out doing everything, you know. But because that is what the virus would require, we have to forego certain things for the time being.
You did not want to say what would come next in terms of
I have an idea, but if I tell you no, you will start to behave as though I didn't tell you that, and you'll turn it upside down and just create more difficulty for us. You, personally.
Clarify again, in terms of the time period that you're leaving.
I was only joking, right?
Construction would stay open by itself for how long, and then the next for how long? When do you want to give that time period?
I wouldn't want to do that, because when we take that step forward and carry that large population of people out, we just have, I wouldn't tell you for 2 weeks, or we have to wait and see. And if when we do that, we are still in a good position, maybe for a week or two after, then we could say, okay, now we can add a bit more, right? So, and I'm just being told by my colleague here that between construction and hardwares, we've vaccinated 15,000 people. That is what gives us some element of comfort to bring these people out, because most of them are vaccinated. And of course, it takes a little while for the vaccine to begin to have an effect. So you still have to be very careful. But it's a cohort of the population which is in a better position than others. And the vaccination program allows us to take this early entry of the. And of course, in manufacturing, we had another 10,000 people in manufacturing. When we said vaccinate to operate, right? That's what we mean. Because this group of people, right, who are vaccinated and have to come out, they are a little more protected than the rest of us, right? And that is how I want to see the conversation go. It is not about, well, let me not raise it because it doesn't make any sense.
Prime Minister, with regards to the vaccine, again, could you bring as much clarity as possible to the whole Pfizer issue?
What?
Pfizer issue, the 80 vials.
That. When you're home and told not to go to work, and you are also on the government payroll in the parliament and you have nothing to do, you could get involved in all kinds of things, you know. It just keeps the mind going. There's nothing to clarify, because it was clarified from day one. But you know, it was so simple, so straightforward, and because you're predisposed not to believe, because as I said before, in this country, especially now, people have been so accustomed to being lied to that when you tell them the truth, now, as I've been telling you all along, you have a little difficulty dealing with it. That gift of the 400 doses to vaccinate 200 people came to the government for permission to accept the gift. A department in the Ministry of National Security, their colleagues who they work with in the United States offered them that handful of vaccines. They didn't accept it. They came to the government and asked, as they normally would do, because government departments don't accept gifts left willy-nilly all over the place. They have to get some authorization. That authorization was given to accept it for that purpose. So it starts with that. And for those of you who raised and made a big issue of the fact that I didn't raise it here, and it got front page about hush hush and secrecy and curious, I'm glad you had something to put on your front page. Because clearly, if I had mentioned it here, you'd have had a blank first page. I could not have mentioned it here last Saturday because after the government gave the approval for the department to accept the gift, no information came back as to when the gift would actually be handed over or when it would actually arrive in the country. So when I spoke here at 2 o'clock last week, I had no idea where the gift was. What I did know is that an offer was made and the department here was authorized to accept it. It was later in the night that I discovered that whoever had offered it actually brought it. Yeah? And in so doing, they brought it into our normal entry system. And I see all kind of conspiracy theory, right? Because somebody was trying to sneak in, but there was no sneaking it in. If we had said no to it, we would have said no to 400 vaccines. Just 400 more than we had. And of course, it turned out to be Pfizer vaccine. And of course, as you know, some people feel that Pfizer vaccine is the Rolls Royce and you have to get that. There was nothing to it. And there was no secrecy. As a matter of fact, the last I heard about it, it went through all the clearance processes and got into the hands of the National Security Department, and they would have used it. Yes. It was used up under the supervision of the Ministry of Health. So what is the problem other than the conspiracy theorists had to have something to do because they were just idle?
We need to clarify the times for next week.
Clarify?
The times.
Yes, please.
Okay, just to clarify the times for the last weekend in June that the Prime Minister, you all would recall at the start of June, what we did is we went with the curfew times, reduced time, a longer curfew time on the weekends, from 7 p.m. on a Friday to 5 a.m. on a Saturday, 7 p.m. on a Saturday to 5 a.m. on a Sunday, 7 p.m. on a Sunday to 5 a.m. the following day. It is only on the first week that we had 2 public holidays that we took a decision to go from 5 a.m. to 10 a.m. on that first public holiday till 5 a.m. the next day. So, Prime Minister, for next weekend, is it that we will go the 7 p.m. on the Friday into 5 a.m. on the Saturday, 7 p.m. on Saturday into 5 a.m. on Sunday, 7 p.m. into Sunday into 5 a.m. on the Monday. It is not what we're experiencing this weekend because of the public holiday today and then the decision for us to just try and slow things down this weekend. So the shortened times the Prime Minister was talking about, or the longer curfew times, would be 7 p.m. into 5 a.m. All right?
And I trust that is clear to everybody and anybody who's listening.
Prime Minister, I saw it was reported by the Education Minister that around at least 2,000 students would have dropped out of school during this period here. How much of a concern is that to you? And
if one child drops out of school, is of great concern to me and to all of us. But in the middle of the pandemic, we know that there was stresses on certain families, certain children, and some people didn't get the kind of support that they should have had, and it would have resulted in them not going through the school system. That's something that is going to come back to us eventually. We will not leave it that way. We'll have to try and find those people later on and see how we can get them back on track for their education in some form or the other. But it is not surprising that that would have happened when there are other kinds of difficulties that we're not talking about yet. Because even those children who have not dropped out of the system, who remained in the system, because of the nature of what the system had become, there are deleterious effects that would have happened to some of those children. So we do have work to do going forward. Right?
Prime Minister, could you give us a timeline in terms of how soon you expect or would like the entire sectors to open back and be fully out?
I would like all the sectors to reopen tomorrow morning, but we can't have that because there are significant constraints. And the major constraint is too many people out together, close to one another. We become guaranteed to have community spread again and national disaster. So I couldn't give you the date and the time you're looking for. What I tried to give you today was the action of coming out cautiously by sectors, because that's how we are approaching it. I mean, there are other leaders in some other countries that simply said, well, come out, everybody come out, and die till you stop dead. We didn't do that. Right? That's one option, and that option has been used. What we've been doing all along is trying to save everybody. As far as we were able to, we did everything that we could to give everybody a chance to be saved. And some of us, as I said earlier on, I'm sure all of us in this room and all of us listening here know of somebody who were affected and probably would have passed away during this pandemic. It's not a joke, and the pandemic is still with us. We are not in a post-pandemic period, and we will not be there for a little while, so let us not get too tired. Thank you very much, and we look forward to an improved report as we go forward. Thank you. Oh, sorry, Dr. Trotman. Sorry, Doc, I keep you for the last. Talk to us about what's happening at home and what's happening in the hospital with respect to persons who require care.
Honorable Prime Minister, ministers, members of the listening and viewing public, members of the media, CMO, excuse me, my fellow colleagues, Dr. Richards and Dr. Hines. Coming last, especially following our Honorable Prime Minister, is a big task. But the task ahead of us is even bigger. And the task ahead of us is to win the war against COVID-19. We are faced in a position where we have thousands of people that are sick at home. We want to emphasize again for the practices at home that we isolate properly, even while we are at home. Those who are COVID positive at home, yes, it's your family. Yes, you want to be close, you want to show compassion, and you want to help. But the way to do that is not to be close together. We have to be sure that in the home, we are practicing our 3 W's, and we're doing it properly. We have to be at home at this time to try to decrease the spread and the congregation out there. But while we are at home, we would want you to please practice the 3 W's properly. For our patients who are in the hospital, amply being taken care of by all of the hospital staff, and I want to say thank you to them as I always do. We do still have people who are ill in the hospital of different levels. And while we are practicing what we need to do for those patients, we need for you to decrease the burden by not becoming one of those patients yourself. That's the best thing you can do for us. And in looking forward to all of what we are trying to offer as a health team, the only way for us to be able to do it is to keep our numbers in a downward fashion. And it's simple. Yes, when you get the call to vaccinate, we want for you to respond and take the vaccine that is in front of you, that have gone under scrutiny that you and I cannot do. That would have been done for you already. So take the vaccine that's offered to you. But remember, we can't vaccinate everyone at once. So what do? You still have armor. You put up your armor. 3 W's. Wash your hands. Wear your mask. And watch your distance. To all the fathers and fathers who are fathers and mothers who are fathers and other people in this society that are fathers, happy Father's Day, and also happy Labor Day. Thank you.
Well, thank you very much. That's a good note on which to end, and I want to join Dr. Trotman in wishing all our fathers and guardians of children who are fathers, I want to wish you a happy Father's Day. Stay safe. Stay safe. Thank you.